ABC News contributor Dr. John Brownstein, an epidemiologist at Boston's Children's Hospital. Thanks so much for being with us. We just saw in Elwyn's report about possible super spreader events. In addition to that, there's been some criticism this week that people are letting their guard down, whether it's because they've gotten vaccinated or just from sheer exhaustion of this pandemic. Are you concerned about another surge, or have we turned the corner here yet?
Morning, Eva. I think that I'm optimistic, but we just can't let our guard down. There is data showing that we're plateauing and even increasing in cases across this country. If you look at Texas, which had that winter storm, people came together. Ending mandates now is just not data-driven, given what we're seeing with the numbers. And we have this concern of active transmission. It's not where we were in the summer. And so we just can't let our guard down as these vaccines are rolling out so effectively. We still haven't quite covered all the high-risk population, and we still have variants in play. So now is not the time to take our foot off the gas.
You mentioned those states ending the mask mandates. A recent CDC report finds that mask mandates will decrease COVID cases and deaths, while in-person dining was associated with increased COVID cases and deaths. Is that an indication that some may be moving too fast to reduce these restrictions?
Yeah, generally the CDC report reaffirms what we know, right? Mask adoption can drive transmission down. And we've seen this, mask mandates that are in play, people start wearing masks. Communities actually are able to drive down the risk of COVID in their communities. When indoor dining opens up, there's additional cases. So it's more of a dimmer switch. It's not just about fully reopening, but how do we sort of start to reopen to adjust what we're doing and then seeing what it looks like in the cases and hospitalizations and not just go full out. I think that what we're seeing is that mask mandates, even if they're gone, people are actually still willing to wear masks. So that's one silver lining, that people are really still behind these interventions.
Let's talk about the vaccine. Some people are now vaccine shopping, some believing that Johnson & Johnson's one-dose vaccine is somehow inferior to Moderna and Pfizer's. How should we be thinking about these vaccines?
All three of these vaccines are incredibly effective. We really have to avoid comparing them. It's apples and oranges based on when they were tested. We know J&J was tested when we had variants and a different time of this pandemic. And when you look at the top level data, all these vaccines prevent hospitalizations and deaths. They're incredibly effective. The J&J vaccine also has unique advantages because it's one shot, because it doesn't require freezing. So that could really be effective in rural communities or where there's vaccine hesitancy. The bottom line is, if a vaccine is available to you, just get whichever one is made available.
Dr. Brownstein, always good to have you on. Thanks for being with us.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.